So now we're gonna check the erythrocytes, but from the point of view of blood smear. So blood smear, and if you check the blood smear in the microscope, what are the specific shapes? You could already tell that this is rather this type of disease or that type of disease. And just don't to remind you, the classical method for staining is the Pappenheim method, and in that method, first we use the May-Grunwald staining, and then we used Giemsa-Romanowski. There are many other modifications, but this is the classical staining. And I'm going to talk about also some, I will just mention it's a specific staining. So some things you won't see in with this staining. So which I'm gonna stress that. So basically, if we have we take a blood smear first, you check again the sizes. So if the MCV is normal, so normocytic, and then we check if it's microcytic and macro. And remember, in microcytic, they're small, but there's one special disease you can tell right away if you use a special staining, and that is a Prussian blue. Oops. Prussian blue. So if you use Prussian blue staining, you will find erythrocytes which have a nucleus, they're blasts, and around it, maybe I should make it blue, there are storages of iron in the mitochondria, and this is of course the sideroblastic. Normally you shouldn't see sideroblasts in the blood smear. In this case you will see it. So remember, sideroblastic anemia, I'm using Prussian blue, and the most common cause is alcohol, as I said already. But remember, it could be lead poisoning, or it could be decreased levels of copper, and also excess of zinc. Okay, as a rare case, but excess of zinc has to do with the copper deficits. Doesn't matter, you don't have to know that, but remember, alcohol is the most important one. So this is Prussian blue. In case of normocytic, you already remember schistocytes. Schistocytes mean fragmented erythrocytes, and mechanically fragmented. So typically they look like this. They're destroyed. Okay, let's say this is a normal erythrocyte. This is it's normocytic. This one is smaller. This one is bigger. Okay, and this one is a nucleus as well. Gotcha. So it's blast. Over here you don't see a nucleus. This is just light. Actually, it's pinkish in the center over here. Or maybe I should again, I will erase it and make it in red. That would be maybe better. So basically, this would be a normal erythrocyte, and over here you see schistocytes. They're broken like this. Okay, and this is typical with MAHA, as we talked about it. So remember MAHA, microangiopathic hemolytic anemia, and again I will stress especially DIC, TTP-Hus, and HELLP syndrome. Then you can have spherocytes, so spherocytosis, and compared, they have a sort of normal volume, but compared to the normal erythrocyte is over here, up over here, they will be beautifully red, like totally. They will have normal size, but they will be spheric, very much spheric. And so this is typical for spherocytosis. So again, mutation of ankyrin and spectrum, and of the scaffolding of the structure of the spherocyte. Remember, they're fragile when you put them in different osmolarity environments, they will burst. Okay, so that's the best test actually for spherocytosis. And then you can have, then also with normocytic, remember, so this was schistocytes, this was spherocyte over here. Still we got the decreased G6PD. So G6PD deficiency, and remember those are the bite cells. So bite cells look like this. See, they're bitten over here, so bite cells. That's very typical, bite cells. So you will see them with normal staining, but with a special staining, not with the Pappenheim staining, remember, or with the other ones than these. You have to do a special staining, and also you could see, I'm going to draw the erythrocyte over here. It could be bitten, but with a special staining, you don't have to know which one. You can see Heinz bodies. So remember Heinz bodies, but not, you won't see them in regular staining, and it has to be a special staining. But these are Heinz bodies. Heinz bodies. This is so typical for G6PD. Heinz bodies, it's sort of a it's hemoglobin which is mixed together. It's condensated together. So there are spaces of condensated hemoglobin. So that's typical for G6PD. Not only this, you can see Heinz bodies and other disease, but remember Heinz bodies and bite cells very much. So bite cells very much connected with G6PD deficiency. And of course the last one, well, if there are decreased levels of B12 or folate, you will always check, not erythrocyte. That the erythrocyte's going to be bigger, but what you will check is a neutrophil, and you'll see that they are polysegmented, and this is a hallmark of megaloblastic anemia. So remember, more than 3, like 4, 5, 6, 7 segments. If a neutrophil has so many segments, neutrophil, and you have a big erythrocyte, it's very likely megaloblastic anemia. Okay, so repeat it again. I'll put it red, or I'll put it in orange now. So remember, if it's microcytic, they're going to be small and special. In microcytic, you can do a special staining for sideroblasts. You put the Prussian blue, and you will see a bluish ring around the nucleus. That's mitochondria filled with iron, most common cause alcohol. Then you can on blood smear see schistocytes, which is there in normocytic anemias, and this has to do with MAHA. So remember, and it could be DIC, TTP as HELLP. Then you can check for if you'll see nice, fully red spheric erythrocytes. It's very likely spherocytosis. You can test it with osmotic tests, test on osmolarity, and not only this, also well. They're very fragile, so beautifully red. So spherocytosis. And then last one out of these is G6PD deficiency, and typically you can see these nice bite cells. They're like bitten like this. So that's typical with bite cells and also Heinz bodies. And the last example are macrocytic, and of course you will check not the erythrocytes, which are bigger, but you're going to aim for neutrophils, and if they're polysegmented, very likely it is megaloblastic anemia. So, thanks for watching, and don't forget to subscribe and ring that bell. And as always, check the description below for supplementary questions and other materials.